Well, I grew up in Shreveport, Louisiana, and then in elementary age, my family moved to Austin, and so I went on through junior high and high school in Austin, and after that went to Texas A&M, and then medical school, Southwestern in Dallas, on up to University of Michigan. I was a little bit of a nerd. I love football, and so I played junior football until everybody got too big for me, because I quit growing about 8th grade. But yeah, I enjoyed science and math, which my parents recognized that and tried to encourage me to go into medicine. I think my father always kind of wished he had been a doctor, and kind of encouraged me along those lines, and they gave me a lot of support. And medicine is one of the more interesting fields where you apply science to what you do for a living. I had one of the first pediatricians back in an era when most doctors were general doctors. Everybody did everything, but one of the first pediatricians to set up practice in Louisiana was my pediatrician in Shreveport. And he kind of reminded me of, he was just a kindly white-haired fellow that was just real good with us and good with the kids and put us at ease. So he was a little bit of my idol. I knew as you go through medical school, you get exposed to the different fields, and you get an idea of not just what you think you're going to like, but as you're directly involved in it, you see what you really do enjoy. And a first decision was to see that I enjoyed a surgical field rather than a non-surgical field, just because of the way you can really go in and do something active with your hands and make a direct difference. You know, procedures versus non-procedures, I enjoyed the procedures. And I gravitated toward orthopedics because I was a sports fanatic. And at the time, the field of sports medicine was kind of carving itself out and being right in the middle of orthopedics. Again, for someone that's likes to work with their hands, it's the fun part. Not always the fun part for the patient, but for the surgeon, that's what surgeons want to do. So you know, the actual operating room experience is one that's challenging but enjoyable. And then later on, a few weeks after those moments, when the patient is really turned the corner and starting to make their recovery and beginning to feel the benefits of whatever procedure you've done, they're, you know, especially in the field of orthopedics, they're typically exceedingly grateful. And you see someone that before surgery limps in, maybe with a walker or a cane, and you can tell they're in a lot of pain, and then you see them those few weeks later walking out, no canes, no crutches, no limp, and often will say, you know, this procedure really made a difference in my life and improved my quality of life. So there's a big reward on that side of things too. Well, my first job after training was in Georgetown, Texas, and that's still where my practice is based to this day. Well, I was the first orthopedic surgeon in the area, and so I started the practice. Georgetown was in the transition from being a small town to being with a very small but strong medical community to one that blossomed to where they had most of the specialists. But Dr. Ken Hunt was the general surgeon who was there a few years ahead of me and was somewhat the trailblazer in taking it from a town that was all family practitioners, all very excellent family practitioners, to a town that also had surgical specialists. It's a nice community. It's always had you know, very strong community ties. It's close to Austin in case you need to go into the big city for something, and yet it still has its own small town identity. And I feel very fortunate because the patients in Georgetown and in Central Texas in general are just good people. They don't come into my office with any agendas other than the desire to get better. very highly motivated to, do what it takes to recover from whatever their problem is and get well. We live in Georgetown. We've been there for these 31 years and been married almost 40 years now. So she's there and texts me when she suspects I should be on the road back from Rockdale to make sure I'm on my way and not running late or not having run off the road or anything. Yes, we have 3 kids, and now we have 4 grandchildren and 1 more due any minute.